All right, folks, here's one for you. Should be a reputable source, Kaiser Health News. States pull back on COVID data even amid Delta surge. 2 state government websites in Georgia recently stopped posting updates on COVID-19 cases in prisons and long-term health care facilities, just as the dangerous Delta variant was taking hold. KHN tells the stories of Georgia in partnership with Georgia Health News. Data has been disappearing recently in other states as well. Florida, for example, now reports COVID cases, deaths, and hospitalizations once a week instead of daily as before. Both states, along with the rest of the South, are battling high infection rates. Public health experts are voicing concern about the pullback of COVID information. Dr. George Benjamin, executive director of the American Public Health Association, called the trend not good for government and the public because it gives the appearance of governments hiding stuff. A month ago, the Georgia agency that runs state prisons stopped giving public updates on the number of new COVID cases among inmates and staff members. The Department of Corrections, in explaining this decision, cited its successful vaccination rates and declining number of COVID-19 cases among staff and inmates. Now, a month later, Georgia has amongst the highest COVID infection rates in the U.S., along with one of the lowest vaccination rates, but the Corrections Department hasn't resumed posting data on its website. When asked by KHN about the COVID situation in prisons, Department spokesperson Joan Heath said Monday that it currently has 308 active cases among inmates. We will make a determination whether to begin reposting the daily COVID dashboard over the next few weeks if the current statewide surge is sustained, Heath said. Another state website run by the Department of Public Health no longer links to a listing of the number of COVID cases among residents and staffers of nursing homes and other long-term health care residences by facility. The grid data launched early in the pandemic gave a running total of long-term care cases and deaths from the virus. Asked about the lack of online information, public health officials directed a reporter to another agency, the Department of Community Health, which explained that COVID information on nursing homes could be found on a federal health website, but locating and navigating that link can be difficult. Residents and families cannot easily find this information, said Melanie McNeil, the state's long-term care ombudsman. It used to be easily accessible. Georgia gives updates on overall numbers of COVID cases, hospitalization, and deaths in the state 5 days a week, but has recently stopped its weekend COVID reporting. Other states have cut back their public case reporting, despite the nation being engulfed in a fourth Delta-driven COVID surge. Florida has issued daily reports on cases, deaths, and hospitalizations until the rate of positive test results dropped in June. Even when caseload soared in July and August, the state stuck with weekly reporting. Florida has been accused of being less than transparent with COVID health data. Newspapers have sued or threatened to sue the state several times for medical examiner reports. Long-term care with data, prison data, and weekly COVID reports the state received from the White House. Florida Agriculture Commissioner Nikki Fried, a Democrat running for governor in 2022, has repeatedly questioned Republican Governor Ron DeSantis' decision to delay the release of public data on COVID cases and called for restoring daily reporting of COVID data. Nebraska discontinued its daily COVID dashboard June 30th, then recently resumed reporting, but only weekly. Iowa also reports weekly. Michigan, 3 days a week. Public health experts said full information is vital for a public dealing with an emergency such as the pandemic, according to the government reports needed during a hurricane. All public health things we do are dependent on trust and transparency, Benjamin said. More from the South. A government, when removing public data, should provide a link redirecting people to where they can get that data, he said. If a state doesn't have enough staff members to provide regular data, he said, that argues for investment in staff and technology. People in prisons and long-term health care facilities. Living in close quarters indoors are especially vulnerable to infectious diseases such as COVID. They are usually hotbeds of disease, said Amber Schmidt, a microbiologist who tracks COVID in Georgia. Family members who want to know what's going on in there. Prison data has been removed or reduced in several states, according to the UCLA School of Law's COVID Behind Bars Data Project, which tracks the spread of COVID in prisons, jails, and detention facilities. A group said Alaska provides only monthly updates on COVID cases in such facilities, while Florida has stopped reporting new data in June. When Georgia stopped reporting on COVID in prisons, the project found only 24% of employees reported being vaccinated. Prison workers can spread the virus inside the facilities and then in their homes and communities. The group reports that at least 93 incarcerated people and 4 staffers have died of COVID in Georgia, and that state has the second highest case fatality rate, or percentage of those with reported infections who die among all state and federal prison systems. Right now, if there was a massive outbreak in prisons, there would be no way to know it, said Hope Johnson of the COVID Behind Bars Data Project. Recent Facebook posts point to cases at Smith State Prison in southeastern Georgia. Heath, when asked about cases there, said Tuesday that the prison has 19 active COVID cases and its transitional center has 1. Mayor Bernie Weaver of Glenville's Tatnall County town, where the prison is located, said he hasn't been told about recent COVID cases at the prison, but he noted that Tatnall itself has had a spike in cases. The county has a 26% vaccination rate, amongst the lowest in the state. That is from Kaiser Health News. This is a follow-up on the post by the New York governor saying that the previous governor, Governor Cuomo, had repressed numbers, had hidden numbers from deaths from COVID that she had to come in and add to the total after she was installed. And everybody knows that COVID numbers are bad for business. And what's bad for business is bad for the state. And what's bad for the state gets hidden. So everybody knows DeSantis has been fudging numbers and hiding numbers and changing categories so that the numbers aren't reflected with reality. New York Times has been tracking excess deaths for a very long time, because at the end of the day, you still have to have a death certificate, even though you don't put anything on it that could be related to COVID. So this is just further proof, further evidence that it's in the state's best interest to suppress COVID numbers. Florida especially, because Florida is what, a tourist state for the most part. Travel, tourism, Miami, Orlando, Florida, Disney World, all kind of stuff, right? That's in Florida. Florida's a tourist state. So if you have high COVID numbers, that's what happens. The tourists don't go. Summertime, spring break, winter travel, that's Florida. If Florida has high COVID numbers, Florida's visitors kind of shy away. They go do other things. I've heard some of myself, they're actually going to reroute their vacations because of Florida's outbreak. So it behooves states to lower the numbers, not raise the numbers. Everybody keeps saying they're raising the numbers for money. The hospitals can kind of do that, but mostly it's the states. The states actually investigate that. The states actually suppress numbers, cases, hospitalizations, and deaths. Hospitalizations are kind of hard to mask. That's kind of hard to mask because that's always public, because you're letting the public know that you can't come here, or there are no beds. You need to take care of yourself. DeSantis didn't even know that his state had ordered backup ventilators and oxygen concentrators from the federal government, but he claims he didn't know anything about it. DeSantis put a woman in jail that was actually collecting the true numbers from the different facilities and counties. So people think that this is not real, that this is not happening, because I just had a sub thinking that the death rate from Delta is not increased, or is not as deadly as the A strain, which in fact it is just as deadly as the A strain, but the thing is it infects more people. So USA Today, the Washington Post, the New York Times, The Economist, The London Telegraph have all been talking about the undercounting of deaths and infections from COVID-19 because they wanted to be suppressed. In fact, I just read an article where the EU is talking about not letting in unvaccinated Americans, unvaccinated travelers into Europe. That's how serious this stuff is, folks. I'm sure Texas will wind up doing what it did last year, which is secure its borders. Texas was stopping inbound traffic, man. If you're coming from a certain place, from a hot spot, you had to quarantine. You had to get checked. So this kind of stuff may happen again. Who knows? You might have to have a vaccination passport just to go from state to state. You know, it's not that far-fetched. As like I said, I hope I don't see it, but it's not that far-fetched. And I want to say the last thing. Rodney had told me like 3 months ago that people need to start wearing masks and they don't need to lift the mask mandate because you're going to get a big spread of COVID. 3 months later, guess what? This is where we are. And the states are still going to lie about it. You know, I'm still hearing disputes about numbers, fights about masks, fights about vaccinations. And you know what? At this point, I'm starting to get tired of it. You know, somebody asked me to do the story about COVID. This was why I did it. That's why with COVID, I do COVID in domestic politics is because one, people ask, and two, some things people really need to know. This is why I do it. Even though I know that's going to be the biggest contention because, you know what? Some people are just stupid. They don't even read. People ask me questions when they could just do like a 2-minute Google search to find out for themselves. Like the person that asked me they made a claim about Delta, how it was less deadly or had less deaths than the original A strain. I said, man, all you got to do is Google it. They post this stuff every day. They post the charts and the number count every day. You don't have to believe me. This is summertime. This is not peak season for COVID. And the cases and deaths already look bad. It's starting to look like winter in certain places. It's not even winter yet. So we don't even want to know what winter's going to bring. So people think that they're padding numbers or adding numbers to make COVID look worse than it is. In fact, they're subtracting numbers because guess what they want you to do? They want you to go back to work. They want you to go back in the public. They want you to go back and eat at restaurants. They want you to send your kids to school. They don't want to scare you away from doing it. They have to do their due diligence by giving you some kind of information. But at the end of the day, they want you to go back to normal because what? That's how they make their money. That's how they survive. If you don't go back to work, guess what happens? You have to get paid. You're a drain instead of a positive addition. So thinking that states, especially the United States government, want you to be too afraid to go back to work, that's not true. Or send your kids back to school, that's not true. Which is why they did it. You got to know how governments work, and you got to know that y'all think that these people are stupid, and they're not. You know, you have the best trained people in the world working at the United States government, especially at the top end. These are not your average Joes. These people went to very prestigious schools. They studied for a long time. They are literally the best of the best, and you guys treating them like they're idiots. They're not. They know what they're doing. And sometimes, can they make false decisions and follow that line? You better hope not. But they know how to read data. They know how to read trends. And they're not going to stick to a talking point that they cannot sustain. So I need to get out of your feelings. If you're gonna dispute, if you're gonna debate, at least find the paper and at least take 5 minutes to read it. Because I get tired of people sending me stuff, and it only 2 minutes in, I see a discrepancy, and I have to pace back. Okay, this is what it said, and then they want to deflect and go on to something else, which is why I read articles. Somebody asked me that. Why do you read articles? I said, because Negroes don't like to read, so I read for them. Anyway, I think it's gone on long enough. This is BGS out, and I'll see you guys on the next.